So, disease stinks, which we've known for a while now. So old physicians have written about using like the smell and actually taste of urine and breath and all the disgusting things to aid in the diagnoses of diseases of their patients. And we don't do this anymore, but it turns out it may not be such a bad idea. So here's a fantastic table I came across in my literature search, given a number of diseases and their smells actually given by people. There's a couple of nice ones. We've got overripe camembert, newly-mown clover. But more recently, it's popped up in the news a couple of times that it turns out the dogs are able to smell cancer. And here we got some dog being presented with a couple of tissue samples, and it is able to distinguish between the tumour and the non-tumour tissue samples, which has obvious medical applications, but training dogs is lengthy and expensive, and we don't really want to drag and sandering dogs around hospitals. And even if they have the technology in the nose to pick out the nuances of the smell, they're only able to communicate a binary response. So, it's not quantitative enough. We don't want this, we want this, which is an electronic nose, which is what James Collins has been displaying with in the engineering department. And I'll sort of briefly cover how this works conceptually. So if you look at your other senses, so sight or vision, it's kind of obvious how you would go about representing these things on a computer. So you've got pixel intensity values for an image, or amplitude, time for a frequency. But if you want to describe a smell, then this is not such an obvious thing to go about doing. A smell is a description of a gas. And to completely describe a gas, you want to give all of the proportions of all the molecules in the gas, but then to represent this in a computer, what is the size of this object? It's not a nice thing to play with. But this is not how biological olfaction of smelling works at all. It turns out that how your nose works is that you've got, I think, about 100 sensors in your nose that are kind of measuring broad properties of the gases. And given these 100 sensors, you can distinguish about 10,000 unique smells. And this is closer to how the electronic nose in Collins's lab works. So each smell has some characteristic signature across all of these sensors. And this is what the data looks like with the machine. So this is the electronic nose, and you put your samples in a little jar, it goes in, it smells the sample after heating it. And this is what the data looks like that you get out. So we've got, this is a single sample of a single smell. You've got 18 sensors here, and just a sensor response over time. And I believe this is what the smell of diabetic urine looks like. So now we can measure smell, we know this, and we know that disease stinks. So there should be obvious medical applications here, which would be very nice, because if we could sort of diagnose unwanted disease using the smell of, say, breath or urine, this is a non-invasive, which is excellent, very rapid, as opposed to taking a blood sample and sending it off to a lab. You can just smell the sample and get an answer out. So the machinery can be a bit expensive, but using it is effectively free. And the machine I showed earlier is about that size, plausible to wheel around on a trolley in a hospital. But things like this also exist, which is handheld. I don't think this makes sense, it's not as good, but the technology is developing. It's plausible that how much better technology of that size could exist not many years in the future. So all we need to do now, we can measure the smell, is figure out matching between smell and disease, which is not such an easy task to do. We could attempt to build some kind of mechanistic model, given all the interactions and the metabolism of the body and how particular diseases change these, and the volatiles that they produce, and the sensors pick it up. So this is just infeasibly difficult. But as I said earlier, collecting the data is essentially free on the machine. So we have a huge amount of data, and we can use machine learning to approximate our models to build up classifiers and stuff. Yeah, so taking the naive approach of this is just sampled regularly in time. We can concatenate all these sensors values of time into one big old vector and attempt to chuck them into some off-the-shelf classifier. But this fails, probably because this is extremely high dimensional and we're working with very low sample numbers, 50, 80 samples. But I mean, there's a lot of structure in the data. We don't need 2,000 plus independent variables to describe what's going on. So what I'm doing is attempting to extract the most relevant information, representing a much smaller dimensionality, in which dictionary learning is working very well. So feature extraction from a field called compressive sensing, which is quite true. And effectively, what you're doing is you've got some sample X and you re-represent it, you sparse code it in terms of a sparse linear combination of elements of a predefined dictionary D. This is a better description of that. So you have some signal and some predefined dictionary, and you just represent it as a small number of elements in the dictionary D. Yeah, so that's given the dictionary. We also want to learn the dictionary. Performing the sparse coding, you just perform this minimization, which is not too bad. You have your reconstruction here, error here, the distance between the sample and the reconstruction, and penalizing the one norm of your sparse coding encourages identically zero values in your sparse coding, which I can elaborate on, but don't have time to in this, so talk to me if you like. And it turns out that we can also learn our dictionary D just by minimizing the same thing with respect to D as well. And this, so this is extremely non-convex in general, but it turns out to give nice solutions given that some assumptions on your data actually hold, like your data is sparse in some places. And yeah, there's a couple of clever things we can do, such as we can constrain D to be strictly positive. So we may want to use mass spec to characterize the gas instead of the nose, and this gives strictly positive data, so that's nice. But I mean, the main thing is we have attempted to learn the dictionary over all of the data ever put through one of the e-noses, and then cut down the elements that are not used to reconstruct things from a specific disease, and then cut down all the elements that are not informative with regard to the classification problem, and then we're ending up with something between 2 and 10 dimensions. This is a much nicer problem than throwing this into the off-the-shelf classifiers gives much nicer results. So ROC curves, I'll attempt to explain these quickly. So we're predicting a disease, say diabetes. Our classifier doesn't take the smell and say you have diabetes or you don't. It gives a predictive probability that you have diabetes, say 0.8, and then you turn this into a classification by setting a threshold, maybe a 0.5. But you can vary this threshold to change the types of error that you get. So you've got your type 1, type 2 error, or sensitivity and specificity if you're in medicine, or true positives or true negatives. And I mean, this is what is being shown here. As you sweep the threshold between 0 and 1, you get a trade-off between your true positive rate and your true negative rate. And on the grey regions here are 95% confidence intervals. So here on type 2 diabetes on a data set that we have from UHC Hospital, we're getting 100% predictive accuracy on our holdout set, which is amazing. And we've recently published a good findings. And TB, AUC, 0.96. I can't pronounce that. HE, it's a liver disease. And again, we're getting really, really good accuracy with these. But I mean, reading around, it turns out that a lot of diseases can actually be predicted pretty well with this technology. I mean, this is really, really promising. So our grand designs for the future is that So there's a big trend towards preventative medicine. Traditionally, you wait until you get ill, and then you go to your doctor, and then you fix it. You wait for the symptoms to appear. Now, this is not the ideal case with a lot of diseases such as cancer, in which a far earlier detection is greatly going to increase quality of life and life expectancy of any patient. And this has serious applications with, detecting diseases such as cancer earlier, given that it's so cheap to run and can quite easily be trained up with a huge number of diseases. And all we need to do is collect more data, exactly, to build more models. That was much quicker than I meant it to be. That's everything. Thank you to Rich Savage, my supervisor, if he could give us a word. James Collins in the engineering department, who's doing the e-noses, and joined first co-author on the paper, the first paper. Thank you. Any questions?
Any questions for Jim?
So you say you're bringing the dimension down to 2 to 10. So what's the original dimension roughly?
It's a little over 2,000. So it's 18 sensors, and we sample it 190 times or something like that. But we actually deal. So this is one machine I've talked about. We also deal with mass spec and another thing called FAMES, which is orientational mass spec, I think. They vary. They vary between 2,000 and 20,000 for the FAMES. That's 60,000. Okay. Big. So we use 4 and model select jointly with other things. Random forest seems to work quite well. But SVM with square exponential kernel, random forest, sparse linear regression, logistic regression, and another one. Gaussian process.
Okay. I've heard of 3 minutes.
Okay.
So for the dictionary learning part, so you, I don't know much about it, so you give the data, you run it through something, you get a dictionary, and then you run the classifier out from that. So it's like, it's not something that's updated.
Yeah. So as I've described here, we learn the dictionary, we sparse code the data, and then we chuck it in the classifier.
Okay.
I'm currently working on jointly learning the dictionary with the parameters of the Gaussian process and updating them iteratively.
Just to comment that the individual time curves looked not too difficult to parameterize given how I understand how electronic nodes works.
Okay.
They look like combinations of exponentials.
Yeah. I'm not much of a mathematician or a physicist. I know how to do machine learning.
There's plenty of people in the room who could help.
Okay. Yeah, that's true.
In the clinical setting, you mentioned early detection of things like cancer that you want to catch it early before a doctor can see anything on a medical imaging or something. But do you envisage any other clinical settings, for example, differentiating between it could be this or it could be that, or give it a sniff and find out which one it is? Or...
Okay, so it looks like this machine is able to distinguish between bacterial and viral infections, which is going to make it save on antibiotics, which is the useful thing. But yeah, we don't know. It's potentially useful.
Are there any other questions? Right, thank you again. Now it's lunch and back in here or downstairs, 1 o'clock.